Hello everybody, my name is Jordan Mast. I am a PA at the Colorado Neurological Clinic here in sunny Denver, Colorado. I've been in clinical practice for about 12 years at a general neurology practice, majority of my time in outpatient work. I have a very strong passion for Alzheimer's disease, so this video is really about setting the stage for developing the relationship not only with the Alzheimer's patient themselves, but with the care team and the care partner. This initial visit is an incredibly important time in the patient's journey because it's where we really spend the majority of time setting that firm foundation for understanding for not only the patient themselves, but also the loved ones. Because really, a lot of times they come in and they don't have an understanding of what the term dementia means. A lot of times people assume that dementia is kind of the milder side of things and it progresses into, quote, Alzheimer's disease. And that's not true. And so having the conversation about dementia being a cognitive impairment disorder with loss of independence, that's it. It doesn't give us insight into the what or the why or the how. Alzheimer's disease is a form of dementia, but Alzheimer's disease spans a whole breadth of different severities. In fact, there's something called asymptomatic Alzheimer's disease because you can start to develop Alzheimer's disease pathology up to 20 years before you start to develop symptoms. And I think that's pretty jaw-dropping to both the patients and the loved ones because they don't understand that you can make diagnoses earlier and earlier. Additionally, when we see these patients, we like to talk about what does dementia look like from beginning to end, and talking about MCI, which is mild cognitive impairment. And that is essentially cognitive impairment with no real loss of independence yet. And then you get into the stages of mild, moderate, and severe dementia, which is really important when we're talking about medications like the amyloid targeting therapies, which are really indicated for those patients in the mild cognitive impairment stage and mild Alzheimer's disease dementia. The other thing that's really helpful too is explaining, well, what does this look like from a diagnostic perspective? And some of these conversations may happen in the primary care office, and certainly I love it when they do. And hearing it twice just helps them develop that more firm understanding of what this disease process looks like. We talk about what the typical workup is, talk about things like neuroimaging, maybe an electroencephalogram, some cognitive testing, but more importantly, we now have more tools at our disposal for diagnosing Alzheimer's disease specifically. In the past, to be blunt, we had to guess because 50 to 80% of the time, dementia is Alzheimer's disease, but that left for 20 to 50% of the time it being something else. But now we have blood-based biomarkers, we have amyloid PET scans, we have lumbar punctures, and it's just a very, very exciting time to be able to diagnose these patients earlier. And future videos will talk more specifically about that. So that was just a very brief overview about what that initial visit looks like. But our next video is going to discuss a lot more specifically on what we talk about in regards to diagnostic testing, what that first initial visit looks like in the way of physical exam. So please stay tuned for that.